So our next speaker is Dr. Marcelo Saad. Dr. Marcelo Saad is a physician specialized in physical medicine and rehabilitation and in acupuncture. He has a PhD in rehabilitation sciences and is a faculty member of the post-graduation Stricto Sensu at the Santa Mauro University in São Paulo, Brazil. He is the president of the Spiritist Medical Association of São Paulo. His areas of interest include acupuncture, spirituality and health, and complementary therapy. Please welcome Dr. Marcelo Saad.
Thank you. Good morning for all. It is my pride and my pleasure to be here. I thank the organization of the event for the invitation. I congratulate the organization of the event for this event, and I congratulate you all for the interest in the matter. I'm here to contribute with this team, distant healing techniques, a tentative scientific conciliation. I tell you, first of all, that we, in the next year, will have our medical congress in Brazil, in Rio de Janeiro. So if you lost the Olympic Games and the World Soccer Cup, you can have an opportunity to go to Rio for a visit us. Unfortunately, most of the program is in Portuguese, but it's an excuse to indulge yourself and go to Rio. And I'd like to say that this theme is a part of a book chapter that is available for free on internet in the homepage of the publisher, the Intech Open, or more easier in my personal homepage that I will give to you at the end of this presentation. So I will not show references of the facts and data I will give in this presentation because the reference is the book chapter. Consult later. And the title of this presentation have the word tentative. Why I tell you this is a tentative scientific conciliation? Because the scientific method has many well-established steps, starting from the observation of a phenomenon in the nature, passing through the formulation of an hypothesis to explain that phenomenon, the prediction to what will happen if we do something. If I do something, then something else must happen. Formulating an experiment to prove, to confront my predictions with the empirical evidence, and to set a conclusion to accept or not the hypothesis. And when we tell about the distant healing matter, we cannot track this path smoothly because the scientific method and its steps are not well done. So we have some conflicting results from research that make it difficult to set a valid assumption about distant healing techniques. But this acceptance is still a leap of faith, but it can be a reasonable faith as we will show in this presentation. And tentative is not bad because, as said by Claude Lévi-Strauss, a French anthropologist that also acted in Brazil, the role of the scientist is not to bring the answers, it's to make the right questions. So this is what we are doing here. We start defining what is distant for us. Distant healing are techniques dedicated to benefit health or well-being of another person who is far away. And this far away may seem like miles away. Another city in a very long distance. Distant healing is any concentrated mental effort to drive reality to a desired result. Are acts of intention, wish, or conscience focus on behalf of others. This is what we call distant healing. When we say distance, as I said, the parts are shielded against physical and psychological influences, which includes the placebo effects, which exclude the possibility of the placebo effects. One person is in one room and other person is in another room or in another building or in another city, and these persons may be shielded from electromagnetic interference by a Faraday cage, so there is no possibility to explain the phenomenon that happens using the current concepts of physics or psychology. And even thousands of miles are not an obstacle for this phenomenon to happen. The causes of the distant healing are unknown. The mechanisms are not yet known. There is no universally accepted theory. The mechanisms involved are not well described. And the phenomenon seems to contradict some sense of the common sense of reality and laws of the Newtonian science. But the effects can be documented. This is important because in many procedures in medicine, we don't know exactly how it works, but we know that it works, and we use it. We not discharge it. So there are detected effects, especially in the nervous system activity. There are small but significant effects when one person directs his intention to another person. We can detect this phenomena, especially in the nervous system, using the EEG or the functional magnetic resonance device. Is this to study the brain and studying also the autonomic nervous system in modifications in the electrodermal activity that reflects the sympathetic action. And also we detect effects in performance of this target subject, such as the capacity to press a button in specific moments. This task is improved when he received good intentions from someone in the other room. And we have this condition. We know some effects that are variable, that are not homogeneous, and we don't know the cause. So it seems a situation like that in a half glass or half empty, half full or half empty glass. And we have a collection of information, but we have some strengths, some weaknesses, and we have contradictory possibilities to focus more in the defects or in the qualities of the current data. When we see this glass, we can focus in the empty part. In the empty part, if we focus there, we will say, I prefer what is concrete and guaranteed, this field seems a dead end, it not worth to go on in this research, in this discussion, when I see only the half empty part of the glass. But if I focus on the half full part of the glass, I would say the knowledge advances by exploration of controversial areas. There is a great potential here. We must look to each one of the parts of the glass, and we will be right. But to be really complete, we must see the full glass, not only one part. That is what we will do today. We will start looking for the empty half of the glass. And when we see the weaknesses, the negative aspects of the distant healing effects, we will always fall in one of these three groups of arguments. And we will discuss each one in following. The first group of arguments is that weak scientific evidence from few studies, many of them with methodological limitations, make a weak body of evidence. The second group of arguments is the lack of a coherent theory aligned to common reality and scientifically acceptable. This is a huge weakness. And another argument is there are practical obstacles to clinical use of these techniques, such as the variability of the results and the low relevance of the effect. The effect is clinically small and hugely variable. So these are obstacles to clinical application. Let's see each one of these arguments. The weak scientific evidence. In fact, clinical trials produce variable results which do not support recommendation for or against the use of the distant healing techniques. And some studies suggest a positive effect, but most of the studies do not. And we stay with this weak body of evidence. But we must remember that most of scientific research are done in conditions artificially set like this one. We must say it in our favor. The second argument, there is a lack of a coherent theory. The supposed vital energy that would be transmitted from one human being to another, it's probably unrelated to understanding of physics for energy. Energy for physics is something that makes a work, that is detectable, that is related to one of the fundamental forces of the Newtonian physics. And when we call it vital energy, we are using an inadequate term. This supposed energy is not detectable by instruments that measure electromagnetic signals. And the effects can occur, as I said, even when isolated in a Faraday cage that isolate electromagnetic fields. So all these evidences make a lack of coherent theory. We cannot explain what we are seeing. And finally, the obstacles in the practice. The lack of uniformity is a huge obstacle because we have unknown factors affecting the response of the target subject to the intention sended. And even when the effect is achieved, the effect is not very clinically relevant. Some effects, mild effects over pain, over anxiety, muscle relaxation, subjective well-being, but nothing that can change the situation of this subject. And so a more adequate term would be complementary health practice rather than complementary therapy, because therapy implies in expectance of a result or something that can help this patient in this condition. And we must set the terminology better. But we also can see the full half of the glass. And the arguments for this part of the glass would be one of these three that we also will discuss in following. The first one is the positive results from serious research may indicate a hidden reality. The second argument is the progressive emergence of a new post-materialistic scientific paradigm will help to create a theory that will explain the observed phenomena. And this practice, although it's not clinically relevant results, this is aligned with a humanistic, comprehensive and integrative health care that is desired from patients. The first argument is a hidden reality. The question here is not the magnitude of the effect, but if it exists at all. So if we can document this effect in some serious research, it will be pointed to a hidden reality. It's like we see through a keyhole, and we will see a very tiny thing through a very tiny image from this keyhole. But it doesn't mean that is nothing interesting behind the door. By the contrary, it calls me to cross this door and see what else is there. What really matters is whether consciousness can affect the material world, not the intensity of this effect. And these findings, the positive findings, invite us to consider a non-physical aspect of the reality. This is a point supporting the continuation of the research and the valuation of the phenomenon. The second argument is a new scientific paradigm that is desired, that is supported by many scholars and researchers that anticipate the need for a transition in the comprehension and the understanding of the reality and the nature. They are calling for a science that includes a non-materialistical elements of consciousness. And a milestone for this progress is a paper that was published 2 years ago. It's a manifesto for a post-materialistical science that a role of well-known researchers and scholars establish the new routine for science to exit the materialistic view and be a truly scientific production committed to the pursuit of reality. And the third argument is a demand for humanization from the patients. The effects, even small, can bring some symptomatical relief. Maybe if we don't offering this kind of therapy, if we could be considered malpractice in the future, we know this can bring some relief for the patient, and we forbid to use it. Maybe in some point it will be considered even a malpractice in medicine. And the NIH brought new concepts. One concept is the complementary health approaches that are practices and products of non-mainstream origin. So we don't have the commitment of offering a therapy if we are offering something that's a complementary health approach, not a therapy properly. Because therapy indicates that I have the commitment to cure, the commitment to achieve an effect. And this approach, the simple terminology change, would make us more comfortable to offer to the patient what he needs. And the NIH also introduced the term integrative health, that is incorporating complementary approach to mainstream healthcare, since it's not harmful, since it fulfills values of the patient, it could be used. And we also can map some ways to fill even more this glass, to progress in the understanding of this phenomenon. We have also three arguments. The first one is new research models with appropriate designs that meet the phenomenon constraints. The second one is emerging models of mind with non-local quantum properties. And the third one is optimizing the efficiency of techniques, knowing its interfering factors, knowing more what interferes with the phenomenon. Let's see one by one. We need more adequate research designs. We are focusing only on randomized controlled trial model that is absolutely inadequate to study this phenomenon. Perhaps we must develop other models that eliminate these biases, such as the control group cannot be created adequately because the family also is praying for the patient. So if I take a ward of hospital and I say I will pray for this group of patients and I will not pray for that group, this is a polluted study because the family may be praying for that group. And the intervention quality depends on the intention and concentration of the healer. So in studies that involves thousands of patients with sometimes more than one healer, we cannot assure the quality intervention. And the other design models must be conceived for to support the needs of the study of this phenomenon. We see that until some decades ago, everything was coherent. the scientist studied the physics subsystem of the human body, and the physician only treated the physics subsystem of the human body. It's equivalent to say, this drug lowers the blood pressure and this patient have hypertension, so this drug I give to this patient. Everything was okay. But currently we have this conflict because the scientist still studies the physical subsystem in randomized controlled trials that eliminate all the interfering factors, isolating the patient to study properties of therapies, and the physician is invited to treat the biopsychosocial system, the human body as a whole. So it doesn't matter, it's not enough to know a drug that lower blood pressure to treat hypertension. I must know much more about the lifestyle of the patient and to see the patient in the society and the mental health of the patient and his spiritual dimension to treat the patient as a whole. And we are challenged to reach this future where the scientist will study the biopsychosocial system and the physician will treat the same. How can we achieve this? For this study in the future, we would have samples of millions or billions of people. Currently, we make samples of hundreds or thousands of subjects. To make studies in this category, we must have millions or billions of people. Maybe we will achieve this with modern technology in smartphones, with applications that can record my data 24/7 and send it to processor that can usefully use this data to produce knowledge about my body and what is good for me. Let's see what future will reserve for us. The second argument is the non-local mind model that are surging. The telesomatic interactions, the telesomatic means one person sending intention to another one, interfering with this target subject. They have characteristics of quantum non-locality. The quantum mechanics occurs in particles lesser than an atom, and they have these qualities. They are unmediated. There's no medium to transmit the sign or the information. It's unmitigated. The distance don't interfere with the effect, and they are immediate in speed faster than the light. So many of these phenomena of telesomatic interactions obey some descriptions of the quantum mechanics. So the advance in quantum mechanics perhaps will explain better the interactions mind to mind. And instead of energy exchange that we usually use as a term, there can be an exchange of information by resonance in a subliminal way. So this is also a question of terminology, of names, maybe changing some names and advancing in some aspects of physics. We will fulfill more the models to explain the phenomena. And also the knowledge of the interfering factors that produce results for some groups and not produce results in other groups. We know that some factors seems to be important. The practitioner with an empathy, focus, and motivation produces most frequently positive results. The health status and well-being of the practitioner. There are also studies made when the practitioner was not well or ill, and the result declined. The emotional connection between the practitioner and the recipient. This may be the most important factor of all, because effects are seen in couples, in experiments with twins, with brothers and siblings. This is an important factor, more than a practitioner paid to produce a prayer or something that has not to do with the subject receiver. The receptivity and hope from the beneficiary. The beneficiary has not to know that he is receiving something, but at least he must be opened to the benefit, not offering resistance. It's enough to be opened, not necessarily knowing she is, or he or she is receiving a prayer or healing intention. And it works in any religious or secular context. It's independent of the cultural and religious, etc. factors. It is more based on the intention. This is a study, very recent, that describes how the research can go. Most of research are done looking for physical effects of their physiological functions, etc. But this study, although it is a small study with a lot of limitations, show an interesting way. This is a mind interfering over other mind in patients with dementia. And the result was hopeful. The result was hopeful because I don't expect a physical effect in the beneficiary. I expect only a mind effect in this patient. So I guess it is the way to follow, a model to be replicated in the future. We must avoid, when we see this glass, we must avoid the two poles of the ignorance. The first pole of the ignorance is the obstinate skepticism that denies the full half. This is an arrogant and prejudiced attachment to materialism that ridiculize the distant healing without a good analysis, simply denying, putting fulfillment in the keyhole and saying, I don't want to see it, it doesn't work. This is obstinate skepticism. And the other pole is the naive mysticism that denies the empty half. She is looking just a full glass. This is an unrealistic expectation on paranormal potentialities, motivated either by greed or by ignorance. But anyway, it is an unhealthy position. The healthy position is the enlightened scientificism, because the true science comes from the Latin cere, that means to know, encompasses many aspects of braveness of the researcher related to a deep and respectful understanding of the work of other researchers, humility before empirically demonstrable abnormalities, and an openness to new ideas. This is the true scientist. And a true scientist is also aligned to this saying of St. Augustine that said, the miracles do not happen in contradiction to nature. They are only in contradiction with what we know of nature. Always in every moment of the knowledge of the science, there is more to know. We are used to think we are in the summit of the knowledge because we produced many things in the last 100 years. Then humankind produced it in millennia. But we must have this humility to imagine that we don't know everything about nature. 100 years ago, for instance, we think the size of the universe was the size of our galaxy, because we saw a star, other star, other star, other star, other star, finish it. Okay, the universe has this size. But 100 years ago, we saw that the spots in sky were also galaxies like others, like ours. And we discovered trillions of galaxies. So the size of the universe increased. You can say this is a small mistake. No, this is a huge mistake. This is a mistake compared to think the Earth is flat. And we made this mistake until 100 years ago. Okay, so this is to humble us, to make another position about what we know. In conclusion, we can say that the glass is half full and half empty. The glass is 50%. And we can map what we have already, currently, what we need still, and how to get it regarding the distant healing techniques. So in the future, we can dream that this would be a class of medicine, and maybe in a near future, students learning how mind can interfere on other mind, and even in matter, and even in health, with useful usage of this in medicine. Thank you very much for your attention, and congratulations for being here. Thank you very much.